everyone. Excellent evening to every one of us. We are all welcome to this evening's broadcast. Welcome to every one of us. Today we are going to be looking at, a very important topic, especially for people who are having such issues: management and prevention of leg and foot ulcers. We're going to be looking at management and prevention. Like I always tell us, prevention is safer, cheaper, and actually better than cure. So I like to share this on my pages, and I also ask you to help to share to your friends also. As I welcome also, if you have joined me online, you can greet, so I can welcome you this evening to this evening's broadcast. We're looking at management and prevention of leg ulcers and foot ulcers. So I'm going to be sharing this on my page, and I ask you to also help share to your friends. And you can greet if you have joined me this afternoon, so that I can welcome you to this afternoon's broadcast. We are changing from 1 p.m. to 5 p.m. because a lot of people say they are at work when we are online. So we want people to be joining us now. More people to have the privilege of being live. A lot of people watch the replay when we are through, and they complained that that at 1 p.m. they are actually not on lunch hour. I thought 1 p.m. would be lunch hour, and many people say they don't actually get to have that lunch hour at that time. So 5 p.m. most people should be either going home, closing from work, or at home. Hello, Grace. Grace, you're welcome to this evening's broadcast. Welcome. This evening we are looking at the management and prevention of leg ulcers, foot ulcers. Hello, Angie. Angie McKay, you're welcome to this evening's broadcast. Welcome. Top fan is always top to Angie. Each time Angie comes live, you will just see top fan. Well, Angie, I'm sure very soon you and those who are the top fans are going to be getting something, a gift from me again. Hello, Fumi, you're welcome. Olotu Victoria, you are welcome to this evening's broadcast as we look at prevention and treatment of ulcers. Someone said you spend a lot of time welcoming people and introducing. Oh yeah, I wish I can just go straight, because sometimes some people will say you didn't welcome me, you were welcoming those you know. We are all my friends, so I love and I know all of you. It's just that sometimes your name will not appear for me to see it, to say welcome. So we are all welcome to this evening's broadcast as we look at management and prevention of ulcers. Hello, Jane Destiny, you're welcome to this evening's broadcast. I'm almost through with the sharing, and we will go through. We'll move very fast today and take our questions. Like I always say, don't think the question will only come from the topic of the day. Ask your questions. It's always good to ask questions. And I also want to apologize to those people who were expecting to get their products today, because Nigeria declared public holiday. FedEx is not working today, so most of your products are in your states or in your cities. So by tomorrow you're going to be getting your products with you there, so just bear with us. We didn't actually know that there will be public holiday today. It came late when I was saying 2 to 5 working days. All right, so I think I'm sharing it on the last page now, and then we go on with the teaching for today. So feel free, ask your question. I'll still come back to Ross here to find out if we have questions. I think I go live here, so I'll be able to see us on time. So we're welcome to this. Oh, Pamela, you're welcome. Yeah, I want to go live on my phone. Oh, welcome, Pamela. Welcome to this evening's broadcast. And Jen Destiny Tom. So ulcers are actually wounds or open sores that will not heal or that keeps returning. When you have some open sores that are not healing fast, Now you need to differentiate between wounds and ulcers. You can have a wound that is still like a fresh wound. Hello, Udo or Hele. You're welcome to this evening's broadcast. Good evening, good evening. God bless you. So, if you have a wound is different from an ulcer. Welcome, Femi, to this Kemi, to this evening's broadcast. So, leg ulcers, are like unhealed sores. You will know when a sore is not healing. If you have a wound that is healing, you will see that it's in the process of healing, and it hasn't stayed for long, and you will just feel that every day you're getting better. Every day the wound is, trying to heal. But when the wounds have stayed for a long time, when a wound has stayed for a long time and is not healing and is forming sores, then that's where there is a problem. So leg ulcers are unhealed sores or open wounds on the legs. Without treatment, these types of ulcer can keep reoccurring. You see a lot of people that they've had their legs amputated because of leg ulcers. So one has to be very, very careful, because this condition is most commonly caused by poor circulation, though it can also be attributed to a variety of some other ailments, as we're going to be seeing today. And these wounds are also common in women. They are common in women, but they also affect both men and women. But, they are most common with women. And if they are not treated early, leg ulcers can improve, can degenerate, and then it will cause amputation. It even causes death. But when they are treated on time, they can actually improve without causing any form of complication. Hello, thank you for the heart loves and the thumbs up. Thank you. Angie is asking a question. How good is it for one to sleep with air conditioner or fan? Well, in a very hot environment, you can use your air conditioner, but make sure you keep warm. And then fan, it's not good for you to leave your fan static or ceiling fan. If you're using a fan, let it be far away from you and let it rotate. In fact, sometimes what I do is to just let the fan cool the room, not blowing directly on me, because it's very, very dangerous, especially for people who are asthmatic, people who have one kind of ulcer or the other, those who have arthritis. Very cold weather is not good for all these ones, but everything should be done moderately. NG, and check how it is. I always tell us your body is the thing that will tell you what to do, how you're feeling, and what to do about yourself. There are sometimes that couples like my husband and myself, I love cold environment. I just love cold environment. In fact, I can put on my AC in the highest and I wear thermal wear and cover my head because I love cold environment. But recently, my husband is not very, very comfortable with very cold environment. So we find a balance for both of us. So you need to find a balance, and you need to be sure you do what is good for your own health. Hello, Ifoma Kate. You're welcome to this evening's broadcast. Welcome, Bene Ifoma, and welcome Emmanuel Remy to this evening's broadcast. So we're looking at ulcers, prevention, and treatment. So I've already, introduced to us that ulcers are wounds or sores that are not healed or that keep, returning. And then that is more common with women, especially for some of the reasons we're going to be seeing, though men also have leg ulcers. Now, what are the causes of leg ulcers? Leg ulcers may be caused by some medical conditions like poor circulation. If you have poor blood circulation, often caused by arteriosclerosis, poor blood circulation can be caused by arteriosclerosis, and that could cause ulcer of the leg. Then there is also what they call venous insufficiency. Venous insufficiency can also cause leg ulcer. That's a failure of the valve in the veins of the leg that causes congestion and slowing of blood circulation in the veins. So usually, circulation is one of the major issues of blood circulation of ulcer. So when you have this venous insufficiency in the leg, being a blockage in the vein, then it can cause leg ulcer. Thank you for the thumbs up and the heart. Then there are other conditions also like clothing, and circulation that may also be related to arteriosclerosis that I talked about. Then another issue, one major issue that causes leg ulcers are diabetes. Hello, Hello, let me say, okay, hello, Oladayo Ainde. You're welcome to this evening's broadcast. Welcome, welcome. I saw a lot of hearts and loves going on. Thumbs up. Thank you, thank you, thank you. I appreciate the thumbs up. So when somebody is diabetic, it can cause ulcer, leg ulcers. When somebody has a kind of renal kidney failure, it can also cause, leg ulcers. Then hypertension, if not treated, can also cause leg ulcer. Remember that I said one of the major issues of that causes of leg ulcer is atherosclerosis, and when you have atherosclerosis, that's a kind of congestion and slowing down of blood circulation in your veins, and high blood pressure can cause that. So if left untreated, it can cause ulcers. Then of course, I think when I was in Germany last month, I treated lymphedema. Lymphedema is another cause, another issue that can cause leg ulcer. That's a buildup of fluid, that will cause your leg to swell or your feet to swell. So lymphedema also can cause leg ulcer for people. All right. So also inflammatory diseases, including vasculitis, lupus, and other rheumatological conditions can also cause leg ulcer. And then high cholesterol. If one is having high cholesterol that is untreated, if you don't bring down your numbers, it can cause leg ulcer. And like I said before, high blood pressure and some kinds of heart diseases can also cause leg ulcer. Then sometimes sickle cell anemia, people who are sickle cell anemia, those that are sickle cell, they can also have leg ulcer. And again, another very important thing we need to be very, very careful of is bowel disorder. When your colon is not healthy, like I always tell us, colon health is very, very essential for anyone, especially for those of us who are at our middle age, because death actually begins in the colon. Death actually begins in the colon. If your colon, your digestive system is not neat, is not clean, you don't detoxify, it can also cause, ulcers. Infection is another thing that can also cause leg ulcer. And then sometimes when people have a history of smoking, either current or past smoking history, it can also cause ulcer. And remember what I always tell us about smoking. Secondary smoke is also not good. Secondary smoke is also not good for us. Hello, Anne, you're welcome to this evening's broadcast. Anne is one of my mentorees. You're welcome, welcome, welcome. So then ulcers can also be hereditary. There are some people is running in their gene. And that's why I say, watch your parents and be careful what you do. If there is a disease that happened to your father, your fathers, your uncles, and then maybe your grandfather and things like that, you have to be very careful. Ulcer is one of the diseases, leg ulcers, that can be inherited from generations up there. So you need to be very, very careful. Another thing that could cause ulcer is pressure. If you're by lying on a position for too long, if you have like people who are sick in the hospital, and they stay in the hospital and they lie down, at a particular position for too long, you'll find out that they begin to have some bed sores and ulcer, it can come. And also people who are living sedentary lifestyle, they are not going out, they are just there maybe out of depression or one thing or the other, they are not going out, they can also have ulcers, leg ulcers. Habiba Abdusalam, you're welcome to this evening's broadcast. Like I said, I can take our questions as we're going on, and it doesn't have to be questions that are just related to ulcers that we're talking about. Hello, Abimbola Agbaje, you're welcome to this evening's broadcast. Abimbola, well done. Abimbola is one of my real good customers. Like I told us, very soon I'm going to be having our VIP page, our VIP Facebook page, and that one is only for those who buy products, my customers, because I need to really particularly take note of your health. Be sure of what you're using, be sure that you're really getting better, be sure that you're aging gracefully. So very soon we're going to open the Aging with Grace VIP page, and that VIP page is only for those who will follow me, who will, we will be accountability partner, that we're going to age gracefully. I have a goal that by the time I'm 70 years old, I'll be looking younger than I am now. That's my goal, and I'm going to achieve it. You're on the journey with me, you will see it. So I need people who will come on. No disease, no visiting the hospitals, no one old age disease or things like that. We will stay in that group, take care of ourselves, make sure we eat well, make sure we do our exercises well, and that we use our supplements very well so that we can age gracefully. So very soon we're going to be launching the Aging with Grace VIP page, and that one is not just for anybody. This page is for anybody. And very soon the teachings there will reduce, because I need to pay more attention on the people there. Not because of money, but I want a group of people who will prove what I'm talking about. So I said that also tumor or cancerous mass can also cause leg ulcers. And I've already talked about infection. Infection can also cause leg ulcers. And again, some medications. There are some kind of medications you can be taking that can actually cause leg ulcer. All right, so we have looked at what are leg ulcers and foot ulcers, what causes them. We have looked at that. So we're going to be looking at the types of leg and foot ulcer. What types do we have? We have 3 different types of leg and foot ulcer, and the 3 most common types are the venous static ulcer, the neurotrophic or diabetic ulcer, the arterial or ischemic ulcers. So I'm going to be using just the terms venostatic ulcer, diabetic ulcer, and then arterial ulcer. Ulcers are typically defined by the appearance of the ulcer location, and the way the borders and surrounding of the skin of the ulcer looks. Those are how it's described. Hello, Nkiru. Nkiru, you're welcome to this evening's broadcast. Welcome, Angela. You're welcome to this evening's broadcast also. So if you join us, you can just greet so that I can welcome you to this evening's broadcast. Adauhu Pascal, you're welcome. Okay, Adauhu Pascal is asking for my WhatsApp number. I'm going to give you my WhatsApp number now. +234 703 515 1642. +234 703 515 1642. Oh, it's T. Mohammed's first time of joining us. Please, can we welcome T. Mohammed to Aging with Grace Facebook page. This is one of our series, Thursday series. It's a health and wellness page where we teach you how you eat healthy, stay away from the hospitals, using natural things you can find about you, lifestyle change that can keep you top of the game even as you age. Thank you, and thank you. Hello, Mary Odushola. You're welcome to this evening's broadcast. So Adauku Jisrael, I've given you my number. Let me try and pin it. Let me go back to my laptop and try and pin that number for you so that you can see it. Okay, I want to pin the number for her so that other people who need it will also be able to see the number. So just give me 1 second so I can pin it. Go back live inside here. Hello, Eunice. Oh, I'm looking good. Thank you, Eunice. Thank you, Eunice. Thank you. I'm losing my hair. I loosened my hair also. So that I can wash and try and hold it back together. Thank you. All right, so let's welcome T as he's joining us, or she's joining us for the first time, and then I pin my number and then we get going. Yeah, okay, I've pinned the number. So my number is pinned on the screen for you. So we're looking at types of ulcer, and I've told us the 3 types of ulcer, and I said that the way they describe it depends on the position, depends on the borders around it and the skin that you find around it. So we take the first one, which is the venous static ulcer, location on the body, below the knee. If you look at your knee, below your knee, this type of ulcer is primarily found on the inner part of the leg, below your knee, just above the ankle. This ulcer can also affect both legs. You know, how does it appear? The appearance is that the base is red in color, and it may be covered by yellowish fibrous tissues. And there may be also green and yellow discharges that will come out of it. You know, if the ulcer is infected, it will have some green and yellowish discharges coming from it. And then the fluid drainage can also be very significant. You will find that the fluid comes out of it. And then the borders are usually irregularly shaped, and the surrounding skin is often discolored and swollen. And it may even feel warm or hot. You know, when you touch it a bit, the person will be feeling the warmth around the skin there. And the skin may also appear shiny and tight, you know, around it, depending on the amount of swelling that it has. Remember what I said, ulcer is wound that is unhealed. But when you have a wound that is healing, you will not see all these signs around it. So that's why you need to know the symptoms, you need to know the appearance, you need to know the border, so that you'll be able to know if that wound is already becoming an ulcer or if it's still in the process of healing. Time is very, very important. The appearance is also very, very important. Who are those that are affected by the venous statics ulcer? You know, it's usually common in patients who have history of leg swelling. People who have history of leg swelling, and those who have varicose veins, or a history of blood clot, is, you know, or either a superficial or deep veins in the leg. This kind of people can actually come up with having leg ulcer, the venous statics ulcer. Hello, Esther Samuel. You're welcome to this evening's broadcast. Valentine Modukbe, good evening. You're also welcome. So, you know, this venous ulcer is actually very, very common. It affects more than 500,000 to 600,000 people only in United States, you know, and it accounts for more than 80 to 90% of leg ulcers generally, and also all over the world. And it's because of how it comes, where it comes, and the things like that. So it's the most common type of ulcer. Then another type of ulcer is the diabetic ulcer or the neurotrophic ulcer. You know, the location in the body is usually, you know, at increased pressure points on the bottom of the feet. That's where you have diabetic ulcer, you know, on the bottom, below the foot, you know. And then it's also related to trauma. Anywhere on the feet that has some kind of trauma, one can have diabetic ulcers there. So how does it appear? It's really variable depending on the person and the patient's circulation, you know, system. But it appears pinkish red, and sometimes it appears brownish black. And then it punches out, you know, while the surrounding of the skin is also often as if it's calloused. So that's how neuropathic ulcer appears. And then neuropathic ulcer occur primarily in people who are diabetic, although it can also affect people who have some kind of impaired sensation due to circulation, like I've told us before, on our feet. The neuropathic or diabetic ulcer and peripheral artery disease often occur together in people who are diabetic, like I said. Then also those who have nerve damages, you know, in their feet can also result in loss of foot sensation and changes in the sweat producing glands. You know, this can also increase the risk of ulcers on the feet. And then it is very, very easy for one to understand why people who are diabetic are more prone to foot ulcers than other patients. And this is because the people who are diabetic need to, you know, actually inspect their feet daily, wear appropriate footwear, and people who are diabetic should never walk barefooted. No matter who is telling you, what they are telling you, whatever you are, make sure you don't walk barefooted. Anybody that is diabetic needs to be very, very careful about wounds. need to be very, very careful about wounds. I'm going to be telling us about the care as we go on in the broadcast. Hello, Mayowa Alabi. You're welcome to this afternoon's broadcast. So we're looking at leg ulcers and foot ulcers. So the third type of leg ulcer is the arterial ulcer. And the location is on the feet, you know, often on the heels. I can't raise my leg to show us, but of course, you know the heels of your heels. And then the tips of the toes. Between the toes, you know, where the toes rub against one another, that's where you have arterial ulcers. And anywhere the bones may protrude and rub against bed sheets, socks, and shoes. You know, they also occur commonly in the nail bed around here, the nail bed. If the toenail cuts into the skin, or if, you know, someone has a recent aggressive toenail, you know, trimming or ingrowth, you know, toenail that is being removed. So that's where arterial ulcers occur. Then how does it appear? It has some yellowish or brownish or gray or black color, and is usually does not bleed. It doesn't bleed, but you will know that the person is having that ulcer. And the borders and surrounding skin usually appear punched out. You know, it will pop out a bit. And if irritation or infection are there, if it's infected or if it has some kind of irritation, there may be some swelling or redness around the base of that ulcer. So there may also be redness on the entire foot if one is having that kind of ulcer. Like even if you're having it in between two toes, you find out that the color of that foot is redder than the other foot that you're having. And the arterial ulcers are typically very, very painful because of the positioning, especially at night. They are very, very painful, especially at night. And the patient may, you know, just, you know, have one kind of relief when he gets off the bed, or when he puts his leg at a certain position, he will get a kind of relief. But when he just drops it normally, it will do as if something is drawing. You know, I don't know how to explain it, but it will do as if something is drawing. So usually people who have arterial ulcer are those who have poor blood circulation in their legs. And they may also be accompanied by some kind of disorder, like I have already mentioned, maybe diabetes, high blood pressure, you know, arteriosclerosis. These are some of the things that can actually cause the arterial ulcers. So we're going to be looking at some symptoms. How do you know if you have leg ulcers? Hello, Chichioma. You're welcome. Hello, Angie. Are you back from work? Welcome to this evening's broadcast, Angie. You're welcome, welcome, welcome. Like I said, we can go ahead and ask our questions. I'll answer the questions as we go on. And the questions doesn't have to be only on ulcers. Any question you have, you can ask your question. So symptoms of leg ulcers, you know, they vary depending on the exact cause, the position, and the type. So the symptoms are different. But ulcers are often painful. But sometimes some ulcers are not painful, you know, and it's due to, usually, like I said, ulcers are due to nerve damage from unmanaged diabetes. And then a lack of pain is one reason why many people, you know, misdiagnose the ulcers themselves and they fail to seek medical attention. And that's why I say timing is very important. The color, very, very important, and how it's swelling. It might not be paining you, but it might be ulcer, and it can be causing some kind of damage. You know, some people have some wounds. They will keep hoping it's going to be healed. Please visit the hospital. Let them look at it very well and be sure what is happening to you. So it's important to make an appointment with your doctor once you see any abnormality in your body. And if you experience some of these symptoms that I'm going to be sharing with you, you know, for ulcer. If you have open sore, give it short time. You know, one thing about our body, God has made our body in a way that our body repairs itself. Our body is supposed to repair itself. So if it's not repairing itself, there is a problem. and you need to seek help immediately. So when you have open sores that are not healing fast, it's better you quickly get to the clinic to ascertain whether it's ulcer or if the wound will heal. Pascal is asking, what supplement are you selling? I don't know which supplement. Which supplement do you want? I'm dealing with ulcer today, so maybe we'll look at some ulcer supplements. But if there's any supplements you need, you can tell me. I can give you. I'm here to give you education and tell you about ulcer, foot ulcers and leg ulcers, not primarily to sell, but I'll also show you what can help you. And if you want to buy, you buy. This is not a marketplace. It's Aging with Grace page, okay? So if there's any supplement you need or any ailment you're having, you can ask the question and I can tell you the supplement that can help you, Pascal. All right, so I'm talking about the symptoms of ulcer, and I say open sores. One, then if you have pus in any wound you're having and you begin to see pus there, it could be an indication. It could be a symptom of ulcer. And then if you're having pain in an affected area, if you're having wound, if you have wound, initially maybe the first time it won't pain you, then maybe the second day you will have a lot of pains because the nerves, everything is trying to readjust to that shock they have. Then from the third, fourth day, the pains are supposed to reduce and you begin to see healing. When you don't see this and you have pains in such area for a longer time, you need to get to the clinic because it might be ulcer. Then if you have a wound, instead of the wound to be healing and reducing, the wound is increasing in size, is a symptom, is a sign of ulcer. And then leg swelling is another sign or symptom of leg ulcer. And enlarged veins is also another symptom of leg ulcer. Then generalized pain or a heaviness on your leg, anywhere you have a kind of wound, is also a kind of leg ulcer. Good evening, Juliet. You're welcome, welcome, welcome. Oh, Boko. Alice is watching from Boko. Wow. I like Boko. I like Boko oranges, the seedless oranges. My younger ones went to Boko. My two younger sisters went to FGC Boko. So we used to buy seedless oranges when we visit them. Then I used to visit Boko also when I got married. So I love your seedless oranges, okay? So you can send me some seedless oranges. Watching from Boko. Alice, good evening. Juliet, hello. My sister is here. You see, my sister that went to FGC Boko is here. Inform me I just come Boko. I see her appearing. Informa, can you see your Boko sister? Alice. That's my younger sister. She's online. Alice, Alice, can you see? Informa went to FGC Boko. So collect some rent from her. Collect rent from her. Anyway, so if you get to the hospital, like I always say, if you have some of these signs and symptoms, it's good for you to get to the hospital. I'm going to be showing you some natural things you will use. But like always, I'm not a medical doctor. I'm an alternative nutritionist. I show you how you can use nutrition and natural things to stay away from hospital and get your healing back, okay? All right, so how are ulcers diagnosed? Your doctor will perform a physical examination combined with testing to diagnose your leg ulcer and determine the exact cause, because also knowing the cause of the ulcer can also determine the treatment that the person is giving. Oftentimes, your doctor will be able to differentiate between a leg ulcer and regular sore just by looking at it. There are likely, a variety of tests also that can determine the treatment plan. If they find out that it's leg ulcer, they can send you for CT scan, they can send you for MRI scan, and then they can also do some kinds of ultrasound or x-ray to be able to know what kind of treatment, because sometimes the depth of the wound also determine the kind of treatment you are giving. All right, my sister is greeting all of you. Bena Ifoma, yes, thanks very much. I would like to know about what Pascal asked for and also on how to shed weight. All right, Bene, if you have any specific issue you need supplement for, I can answer you. Pascal asked what supplements I'm selling, and I said I sell all supplements. I sell every supplement that can help you from head to toe. Like you can see my hair glowing, nothing, you know, no hair falling even at this age. Why? Because of the products that I'm using for my hair, natural products. I use jojoba shampoo, jojoba conditioner. I sell them. I use my aloe jelly, you know, to make sure that my hair is well receiving nutrition. So I sell from head to toe. Anything you need from head to toe, I sell it. But today we are looking at ulcer. And then to lose weight, Bennett, I'm doing a promo on weight loss. I actually didn't come out here with it, and I don't want to run out of the out of the screen today. So you can chat me on the WhatsApp, and I'll show you what the promo is. We have a weight loss pack, and which is supposed to be going for nearly 70,000, but I'm doing a promo on it. The weight loss pack, you get a free aloe vera gel, you get your free fast break, and I coach you on how to actually lose that weight. It's not just about selling the products to you. I take you by the hand and I coach you day by day and make sure that you lose that weight and stay healthy. So it's just going for 43,000 naira. It's a 9 days weight loss program, an intensive weight loss program that jumpstarts your weight loss journey, you know, and lifestyle change journey. So Bennett, if you want it, or anyone who wants it, you can just put C9 on the comment section, and I'm going to be chatting you privately to be showing you. And then if you want it faster, chat me on my WhatsApp. I'm always on my WhatsApp, and you'll be able to get it very fast. Okay? All right. So we were talking about treatment of ulcer, and I've told you how your doctors will go. So treating leg ulcers is crucial. 1, to relieve pain. 2, to prevent infection, and then to stop the wound from growing in size. That's why it's very, very essential that you treat ulcers very fast. And then if it has pus, and if pus is draining from that ulcer area, then it's likely there's already an infection on it. So infections are treated with antibiotic to avoid further complications. And of course, you know that it's very, very important that you mind how you take your antibiotics. We have a natural antibiotics that one can actually take, and I'm going to be showing you some beautiful products that you don't have to swallow that can actually handle ulcers very soon. All right, so sometimes they use compression bandage, you know, to ease off the swelling close to the wound, and also to prevent infection. You know, the doctor will prescribe some ointments that you can use, but I have one ointment, that Aloe First. This Aloe First is a miracle ointment. In fact, I have a friend of mine, one of our colleagues, that this was the reason why he joined our company. He's a medical doctor. He's a professional medical doctor, and he deals with wounds. That's where his profession. So he specialized. So he had a case. He deals with wound from time to time. So a case was referred to him from Ado-Ekiti. He's in Lagos. So that man was already suffering from intense top grade ulcer. They were about to amputate his leg. They had tried every means. He's gone to teaching hospitals and the rest. Nothing was happening. So because he had treated some people, someone now asked and told the patient, he said, go to that man. I don't want to call the name of the doctor. So when the person got to him, he said, they referred me to you. They say you normally help. So he said yes. And he brought out this Aloe First. It comes with a pump. It's sealed. That's why I'm not putting the pump in it. This is sealed. Mine is on the table. So actually I use it for my hair, because sometimes when I just want to prevent any form of head injury and the rest. When all those hairdressers are making your hair and they injure you here and there, I spray it on my hair from time to time so that I'm sure I'm covered, you know. And then people who wear shoes that smelling or that can actually bring all those sores, Aloe First is very, very good. It comes with a spray, like I said. If you have a man around that the shoe is not letting you rest, buy Aloe First and just spray it when he's not looking. You gotta spray it on all the shoes. You will be free from the smell. So it's very, very fantastic. It's very good for wounds. Like, I just took time. I said, let me even read what is there. It has aloe barbadensis leaf juice, stabilized aloe vera gel. It has glycerin. It has bee propolis. Bee propolis is a natural antibiotic. It's here. Because I was just wondering, well, how come this thing prevents further infection? How come it heals wound so fast? In fact, the story I was telling you about that doctor. So the doctor took that man and he started applying aloe first, forever bee honey, and then giving him fields of green, ginkgo, and absorbent C orally. So he was giving him these 3 orally, and then using these 2. He wasn't even giving him honey to drink. He was using honey to dress the wound, and then the aloe first. Just before dressing, he would spray it. And in like 3 weeks, they saw very great improvement. In fact, when the man got home 2 months after to Ado-Ekiti, people could not believe he was the one. That's somebody that everybody refers to, the man with that wound. Hey, God forbid. There will be no use sickness to describe you. That man said that was how they were describing him. The man with that wound. Everybody knew him around. He got home healed, working very well. And these 5 products I showed us was what performed the miracle for him. So, you know, you can use all this. But in severe cases, your doctor may order, you know, one kind of braces that can help, especially for people who are already having very serious wounds. They can order some kind of braces so that the person can walk better, and also to prevent further ulcers, you know. So these products have shown us are very, very good, that can help anyone that is having ulcer, no matter the stage of leg ulcer that the person is having. And also sometimes the doctors also recommend aspirin to prevent blood clotting, because like I told us, blood clot is one of the reasons why people have ulcer. And then if you want natural supplement that can help thin your blood and prevent blood clotting, our Forever Active C is very, very fantastic. We use it a lot for those who are having clogged vein, you know, for people who are having clogged vein. Oh, Adahu, Pascal says she's watching from Ghana, Accra. You need advice on aging and supplements. Chat me on my WhatsApp. I can always get supplements to you in Accra. Please chat me on WhatsApp so that you'll be able to get the details of what you need. All right, so treating leg ulcer, you know, is very, very crucial to relieve pain, prevent infection, and also stop the wound from growing further, like I told us, you know. And I've already said, if you're having one kind of pulse, then that means it's already infected. If the leg is already infected, topically, you will need aloe first to spray on that leg. It will help it to heal faster. And then orally, you can also take our bee propolis, our ginkgo to help circulation, our fields of green to help with your getting enough things that you need, and our absorbent C to help the healing very, very faster for you, to make it very, very faster for you. All right, so particularly, there are various ways they treat all the 3 types of ulcers that I've told you. I don't think time will permit me to go through it in explanation, but I'll just read my notes very fast for you. Venous ulcer are treated with compression of the leg to minimize edema and also swelling. And then they use compression treatments, which include wearing compression stockings, multi-layer compression wraps, you know, can be used. And they also, the type of compression treatment prescribed is also determined by your doctor, you know, based on the characteristics of the ulcer and also the drainage, you know, system of that ulcer. Then also the dressing prescribed will also depend on the type and the position. But generally it includes moist dressing, and that's why I talk about aloe first a lot. And then they will also use some kind of collagen wood dressing. And of course, remember, absorbent C has collagen that also helps to heal the wound faster, you know. And then they can also use anti-cobal dressing, depending. When you need that dressing, you need to first of all visit the hospital, so they will be able to show you what kind of dressing you need in the hospital Please don't do self-medication when it comes to ulcer. You must get professional advice and professional dressing. Also, we also have the arterial ulcer dressing, like I told, ulcer treatment, you know, and they also vary depending on the severity, how severe, what stage is the ulcer in. That's what will determine how they treat it. I don't want to go through that, because it's better you visit the clinic for them to find out and then tell you what to do. But let's just quickly go through some kind of food care guidelines. What are some guidelines you need if you want to take care of your feet? All right. So, first of all, anytime they're talking about ulcer and ulcer treatment, it begins with careful skin and foot care. That's where it begins. Your careful skin and foot care. You must take care of your skin. Let's not joke with our bodies. You know, a lot of people will go buy expensive clothes to cover the body, yet you're not spending to make sure your skin is well taken care of. You're growing wrinkles everywhere and there because you're not taking care of your skin. When will you do that? This is the time. And that's why this is Aging with Grace business page. You need your collagen. If you have reached your middle age, you need to take collagen. You're not producing enough collagen again, so you need to supplement with collagen. And then inspecting your skin and feet is very, very important, especially if you have one kind of diabetes, or you're being hypertensive, or you're having issues with blood circulation. You know, detecting and treating the foot and skin sores early can actually help to prevent infection and also help to prevent the sore from getting worse. You know, some people, they will have just mosquito bites. I've heard of somebody whose arm was amputated because of mosquito bites. Things like that. It's carelessness. You have a mosquito bit you, you scratched, and then the wound is as if it's going, you scratch again, the wound comes up again, you scratch again. You know, you keep scratching and it's not going. I gave a testimony concerning one product that helped me some like 3 years ago, and that was this simple, I call it small but mighty, aloe lip. I used to have one wound. I don't know how it came. I don't even know if I have the spot again. Yes, it's here. If you look very well, you will see one dark spot here. You see this dark spot? This thing was a protruding growth. It was protruding. And you know, one thing about it is that it will be itching me. I will scratch it, it will come back again. It was becoming like a problematic ulcer. It will come back again, it will bleed, then it will have a growth. So when I went to my doctor, after looking at it, he said, you have to go and visit a dermatologist. I said, there. He gave me an appointment. He gave me, you know, all those their notes to go and visit a dermatologist. This was like 3-4 years ago, yeah. So I said, which one is this again? No, me that I'm not going to hospital for all this one. Which one is this? Thing stayed for like 1 year. I refused to go. So we were having a business meeting, and one of our sister, Pastor Bola, she just said, mommy, why don't you use aloe lip on this your hand? You know, that, you know, it removes growth. So it helps with ulcer, things like this. I said, there. I said, aloe lip. She said, yeah. She said, I used to have, you know, one. She showed me, and that she used it, and it went in like 2-3 months. I said, there. So I said, so if this thing will go in 2-3 months, let me go and buy aloe lips. I just went and bought 12. I said, it's today. Like joke. Oh. I started rubbing it. Anytime I remember, like this, if you go to my bags, you will see one. Each bag will have this stick, you know. From that time, I just picked this one from my purse, you know. So I just bought it and I was rubbing it morning, afternoon. Anytime I remembered, I'll rub it. I mean, this thing has stayed for 1 year, and it was almost as thick as this. That's how the thing was going in, healing. Because this aloe lips also has propolis. Propolis, like I told us, is a natural antibiotics. It has aloe vera extract. It has propolis. See, it has jojoba also. You know, very, very good. You know, so I just kept putting it until the whole place healed. and it became smooth. I can, if you know, I can, it's just this small dark spot that is remaining from it. So like, what was I saying? You need to take care of your body. If I didn't start to take care of this, maybe it would have been an issue. That woman was just a mosquito bite that grew and became an ulcer that made them amputate her head. So you need to detect and treat all kinds of foot and skin sores early, so that it can prevent further infection and also prevent the sore from getting worse. Then you need to gently wash the affected area very, very well every day with mild soap. And I love my avocado soap. This is one soap that when you use it, you're sure. You know, I used to use antiseptic soap, you know, and what do they call those soaps? Like Dettol soap. I don't want to call companies, but this soap has replaced both. For my grandchildren, you can use it for a baby. For my children, for myself, it does the work of that an antiseptic would do. A soft mild soap in a very, very, with natural things. It has natural avocado oil that can help all forms of healing. So you can use avocado to wash the affected area, to remove dead skins and other debris, and then draining it. Then again, you can gently and thoroughly dry your skin, you know, with a soft towel, and then you apply your aloe first. You spray the aloe first without touching it. It has a spray, like I said. You just spray the aloe first on the affected area and allow it to absorb it very well. You know, don't rub skins or affected area, like those ones that are in between your toes. Just use your avocado soap, wash your feet well, use damp towel to clean it well, and then you spray your aloe first on all those affected areas, you know. And then every day you need to examine your leg as well as the top and the bottom of your feet and areas around your toe. You know, you need to look for blisters, look for cuts, look for cracks, scratches, and other sores, especially for diabetic patients, those who have intense blood pressure, and those who have issues with circulation. You need to actually look at and maintain your skin, and you check for redness, check if the area is warmer than the other areas of your body, and also be sure that your nails are not growing in, you know, or forming any kind of calluses or any kind of cones. You can actually use mirror if you're on your foot, or you know, you can use a mirror. Put your leg, your foot up, and put a mirror so that you can see, because sometimes it's not easy for you to look at your legs like this. So if you use a mirror, like a big hand mirror, to look at your leg very well, or you can ask your spouse or a friend that is close to you to actually examine those places for you. So some other cares you need: once or twice a day, apply some kind of lanolin based cream. And I always advise people to use aloe vera jelly, you know, on the leg and the sole of your leg, top of your feet, so that you can prevent dryness and cracking. This is pure aloe vera. So you apply it like 2 times a day. Then again, do not apply lotion in between your toes, please. Don't apply lotions in between your toes or on areas where there is already an open sore. It's not good, because some of the chemicals that they use in making those lotions are not good. So that's why I always advise aloe jelly, because it's pure aloe vera, stabilized aloe vera. So if your skin is extremely dry, you can use moisturizing cream. And this moisturizing cream, don't apply it where there is sore. Just apply it in the other good areas. You can use moisturizing cream, but you apply aloe jelly on the affected area. So care for your toenails regularly. Cut your toenails after bathing, because when you just finish bathing, it's soft. It's not good for you to cut your nails when they are very hard and you're struggling with it. Cut it when you just finish bathing. or if you've not bathed, you dip it inside like a warm water so that it can absorb the moisture and become, you know, softer for you to cut. Then if you have diabetes, it is important to see your podiatrist very, very often so that they can also help to treat you. Don't self-treat yourself when you have Crohn's or calluses or other food problem. Please, I always talk about this. Don't be looking for how to save money and then now bring more deadly things to yourself. Keeping your wound clean and dry is very, very important. These are some of the cares you can take care of at home. Some people complain, I can't get to the hospital, you know, it's far and things like that. You can visit the hospital, ask them what to do, and help yourself at home. So you need to, one, keep your wound clean and dry. Change the dressing as directed by the, you know, hospital, and then take your medications. It's very, very important. And drinking plenty of water is very, very important if you're having diabetic ulcer or any of these venous static ulcer or arterial ulcer. Is very, very important. Water. I love drinking water. Then follow a healthy diet. Eat plenty fruits and vegetables. And if you can't get enough vegetables, fields of green, very, very affordable. This is one of my cheapest supplements, but very powerful. This will give you enough vegetable for the day. If you take it as recommended, it gives you enough vegetable for the day. So even if you don't get to take vegetable any day and you're taking your fields of green, you're okay. Then you need exercises. You need to exercise regularly. You wear appropriate shoe, because strong kind of shoe can also cause leg ulcers. And then also make sure that you take care of yourself. Now, let's finally end with prevention. How do you prevent ulcers? How can ulcer be prevented? First of all, you need to control the risk factors that can help ulcers to develop or make ulcers to develop. Number one, poor circulation is the most common cause of leg ulcer. Poor circulation. So it makes sense to control the condition that can cause poor circulation. So what are some of the conditions that can cause poor circulation? Hypertension. Hypertension. Control your blood pressure. Know your numbers and control your blood pressure. If you want to know how to control blood pressure, you can chat me on my WhatsApp number that is already pinned on the screen, +234 703 515 1642, and I'm going to be taking you through how you can control your blood pressure. I also have a book on Healthy Hearts Guidebook. Very beautiful. It will also help you. I've already helped a lot of people control their blood pressure. At least I have good testimonies on that area, you know. Then manage your blood pressure, like I said. Control your hypertension. If you're hypertensive, control it. And then if you're diabetics, manage your diabetes and other health conditions that you're having. And then if you're overweight or obese, lose weight. It's very, very important, especially for those who are diabetic, who are having ulcers, who are hypertensive. You need to control your weight. And that's why I'm doing a promo on weight loss, guiding you on how you can lose weight, guiding you on how you can jumpstart your weight loss journey, and then removing up to 25,000 naira from that pack for you. So you can also DM me, say Clean9, and I'll show you what to do about it. Then you need to stay well with healthy diet and regular exercises to reduce weight, and also to eat well and be well. This will also reduce the risk of you having leg ulcers. Then very, very important, reduce your sodium intake. It is absolutely important. Salt, too much salt is not good, especially for those of us at this age. If you're diabetic, if you're hypertensive, if you're having ulcer, if you're having high cholesterol, reduce your sodium. And how do you do that? You know, use fresh foods instead of packaged food. Most of these foods that are already packaged in factory, they use sodium. So you need to make fresh food. And then read your labels. You can see how I held this, and I read the labels to you. This is fantastic. In fact, as I moved on, I saw that it has sage leaf extract. I saw that it has ginger root extract. I saw that it has centellum, you know, wood extract, you know, it's just fantastic. So you need to learn to read your labels. If you're buying packet foods, anything you're buying, turn to the labels. Thank God that today, even in Nigeria, they are insisting people put what they have inside the packs outside so that people can see. Then, like I said, control your cholesterol and your triglycerides level by making dietary changes and taking medications that are prescribed to you. I have also supplements that can help you control your cholesterol if you're having high, you know, cholesterol. I have products that can help you correct that. You can also DM me and I will help you. Walking is very, very important, you know, because you might know if you're having leg ulcers, you might not be able to do strenuous exercises, but sit on your fitness ball, do your walks that can help you. And then you can also ask if you're having poor circulation, you can be on Acti-C. Acti-C is omega-3 fish oil. Ours is very, very good. It will help to thin your blood, and also with ginkgo, it will help blood circulation that will go to the leg. A number of people will eventually have ulcers because the blood circulation is not flowing well. And at a certain age, especially those who are at menopause or post-menopausal stage, they might have issue with circulation. All right, I just wanted to run through before I take our questions because I think we have gone 1 hour. Oh, thank you, Mariwa. Mariwa said it's an educative program. Yes, that's what it is, because knowledge is power. What you know can actually help you come out of what you should come out of. Okay? All right, so thank you. All right, so Pascal, you can chat me. You can chat me so that I'll be able to tell you what supplements you will need. You can chat me if you're having fungal infection on the leg. Aloe First can help because it has bee propolis. You can also take bee propolis inside. We also have what we call aloe activator. Chat me. Who is this? Bola Adeyemi. Chat me on my number, so I'll be able to prescribe what you will need for you. My time is over. It's already 6 o'clock. Thank you, Happy Wala. Cynthia. Oh, thank you, Cynthia. Thank you for all those who are appreciating me and the thumbs up and the hearts. I really, really appreciate. I'm very, very happy. Happy said, how about someone that has tonsillitis for a long time and is enlarged but no pains? I'm going to be chatting you. Chat me on my WhatsApp, please. Wala, it's very, very important that I answer you. Kindly chat me on my WhatsApp so I can give you the supplements that you need to give the person. They are natural supplements that can help give the body what the body needs so that it can heal from inside. My time is over now. Thank you all for joining me. I really appreciate the thumbs up. I appreciate the love. I appreciate your staying tuned from beginning to the end. And feel free to chat me whether you want to buy supplements or not. Like I told us, I'm not here to sell. I'm here to give you education on what can help you. And if you feel what has helped me would help you, chat me and I'll be able to sell them to you. Like aloe lips, very, very important. Aloe First, very, very important. They all have aloe vera gel for healing of wounds, like honey, very, very important. And then orally, I've already shown you what you need. Thank you for joining me today. I love you all. Bye.